Hello, welcome dental assistant rock stars. This is Julie, and today I have a special guest. And this is like a really fun special guest. She, Linda Bartolomucci Boyd, is the author of our I call it our Bible for dental instruments for chairside. Like, I don't know everything in here, but if I need to know something, this is where I go. So, welcome, Linda. Thanks for coming on.
Thank you. Hello, rock stars. Nice to meet all of you. Hopefully someday I get to meet all of you someday at a
We're
conference.
hoping maybe she'll come to the conference in October.
Oh, that'd be great. The dance conference, absolutely. That sounds like fun. Well, I appreciate, and I'm going to probably this is the new edition that will be coming out in, I think you could probably get it in April. You can do a pre-order on Amazon. But right now, and it's basically the same. It's the same format. There's additional photographs and additional identification of some of the instruments and equipment. So I'm going to go through, first of all, I guess I should tell you a little bit about who I am.
Let's learn who you are and why
you're
so passionate about dental assisting.
I'm very passionate about dental assisting. I have to tell you, when I was in high school and I went to my dental appointment and I saw the dental assistants and I went, oh, that's what I want to do. I want to be a dental assistant. And that passion has never left me. It's amazing. Yeah. So I went to UCLA, happened to have a dental assistant extension program. And so I did that. And then that was in Southern California, obviously. And then I worked in Beverly Hills for 8 years. And that was a wonderful experience. I worked for 2 doctors that were from the dental school at University of Southern California. And I learned so much about dentistry. It was absolutely wonderful. So that started my career. And of course, it was pretty exciting working in Beverly Hills, but yeah, very exciting. I can imagine. So then I moved to Northern California and decided that I wanted to get into teaching. So I went back to school, and I had some college, but I went back to school and got my bachelor's. And then I taught at different community colleges in the San Francisco Bay Area. It's very hard to get a full-time teaching position, but I did. I had a teaching position at Diablo Valley College, and it's by Walnut Creek. And prior to that, I worked at City Colleges of San Francisco and College of Alameda and several other colleges. But then when I started working full-time as a professor, it was wonderful. And I taught, oh gosh, all the different dental materials, radiography, head and neck anatomy, systems of the body, all of the things that you're taking that you need to know. And again, I've never lost that passion. And when I was teaching the students instruments, they kept saying, you need to write a book, you need to write a book. And what I did was I had 5x7 cards and I laminated them and I Velcroed the instrument on the back of these cards. And some of them were kind of heavy, like the oral surgery instruments, right? Yes. And then there was a number on the card. So let's just say a mouth mirror, and there was a paper that went along with it with 2 columns. Number 1 was a mouth mirror, and then I would give a little description of what a mouth mirror was. But if you didn't know what a mouth mirror looked like, you could go to the bin, pull the card, and there was the card with the Velcroed instrument on the back. So that's how
system.
That's how I started it. And so hence why the chapters in this book, and the first chapter is basic instruments, which is the Mouth Mirror Explorer, cotton forceps, or cotton pliers. So that's how the book began. And the publishing company actually was looking for someone to write this book. And so I did. I went on sabbatical to research in the United States the most commonly used instruments. Because if you looked at a dental instrument catalog from some of the companies. There are thousands of instruments.
Thousands.
So yeah, and I wanted to put in the book the most commonly used.
Right.
So I went, the state of Washington, Massachusetts, California, different places around the United States to ask, what are the instruments you use for amalgam? What are the instruments used for crown and bridge? And what do you use the instruments for extractions and perio or hygiene?
Right.
So that's how I came up with the instruments that are in this book. And of course, there are new instruments that come about.
Right.
But generally speaking, some of these instruments haven't changed for
years.
Decades. Yeah.
They have.
I mean, it's amazing. It's actually amazing. Yeah.
So each section of your book, which is very lovely, and I love it, and I've used it to teach myself, and I'm sure a lot of instructors over there, each student of mine was given this book, and it has fantastic teacher resources, just so you know.
Right. Yeah.
It does. If you're part of Elsevier, it has some great, fantastic teacher resources. So each section of this book, let's describe why and how you laid it out and what the purpose was, so that we can help, with the mouth mirrors, you have pictures and then you have this beautiful laid out description. Go through each category with me.
Okay, I will. Yes. Okay. Thank you. And the reason for me, I like to learn in a very simple way. Tell me what I need to know and tell me the reason why I need to know it. And then it makes more sense. So every single page of the written page is the same format, because I don't want you to try to figure out how you're going to learn the instrument. Mm-hmm. Every single page is the same. So it starts out with the name of the instrument, okay?
Which is the actual name, not what doctors call it.
Okay, yes, thank you. And I was going to say that because a lot of times, let's see, an instrument that would be a Woodson. A Woodson is kind of a universal instrument that's used a lot for leads. One end is a paddle, the other end is a plugger, and doctors will call that a plastic instrument.
Right.
So it's not it's because 100 years ago, for some reason, they used they used plastic material, and so that name, the plastic instrument, has just come up even with the young doctors. But I tried not to use names that were like, for instance, like a pair of jeans, blue jeans or blue jeans, but then there's all these brands. And so I tried to use the actual name of the instrument. Yes.
Which is helpful because if you're taking your DAMBs or any type of test, those names are going to be on that test, not what you are going to call it out in the real world.
Exactly. And so what you learn, what the dentists learn in school, or what anyone learns in school, I always say, when you go into an office, it takes a life of its own. So these names of these instruments could be different, but you need to know what the correct instruments are called. So first of all, then it's the name of the instrument, and then you have the function, the main function of the instrument. So what the instrument was designed for, and usually what it is used for. And then the characteristics could be what another area or another procedure is that you would use this instrument, or some very specific, like if it's double-ended, then I would describe one end as a paddle, one end as a plugger. So that's what the characteristics are. Whatever special characteristics that particular instrument has, that's what is in there. And then the next one is the practice note. The practice note will tell you what tray setup this instrument belongs on.
The practice note is for the tray setup. Awesome.
Right. So now, like I said, some instruments are used in other areas, but and at the end of each chapter is an example of what a tray setup would look like for those instruments in that chapter.
Awesome. So at the end of each chapter is tray setup. So if you're struggling with your tray setups, go to the end of the chapter.
Right. Now, every dentist likes different instruments for their tray setups, but basically this is an example of what that would look like. And of course, the tray setups, the way it's set up, or if you use a cassette, it's used in usually the sequence of use. So you're going to have your basic setup, and then if you need to have like a spoon excavator, then you would have that, or whatever other instruments come after that. So the important thing is to know the instruments, to know the function, to understand which procedure it belongs to. And then when you're assisting, it makes it easier. If you don't know these instruments and you don't know the function, it makes it difficult, because our job as an assistant is to be one step ahead of the dentist. So if they're carving something, you know, they're going to need this carver next. So a little funny story is this doctor that I used to work for a while, I would hand him the instrument. He'd look at it. He'd look at me and he says, I guess I need this one because you're giving this to me. Because it's like almost I knew before he did. Needed. And that's a goal to have as an assistant. And that's what makes you a really good assistant. We don't want to be a regular old assistant. We want to be the best assistant. We want to do best practice. One step ahead all the time. Yeah. So then after the practice note, which, you know, it's the tray setups or procedure, then it's the sterilization note.
Which I love, and you've added this since it went editions ago, because I know my original book that I have does not have this. So this is a good thing, because there's a ton of questions assistants have on how to properly sterilize or disinfect an item. And some of them are reusing things that should not be used, or sterilizing them improperly. So the longevity of that item is not going to go longer ways.
Yes, sterilizing instruments is extremely important to me, and it should be to everyone. And that the processing of instruments is, first we have to pre-clean, because if that's one of the important things of an instrument is you need to pre-clean it. You have to get all the debris off, because if you leave debris on the instrument and you sterilize it, the bacteria that's underneath the debris is not sterilized. You can't just flick off the material after it's sterilized and think it's a sterilized instrument. That's not proper. So in the sterilization note, I have very explicit, it's pre-cleaning, and then you wrap it or put it into cassette. And then you have to put the indicator in there, right? To then know if it at least reached the temperature. Now, once a week, you have to do the spore testing to be sure that the sterilizer is getting to the right temperature and actually is sterilizing and killing the spore-bearing bacteria.
Absolutely, once a week.
Right.
And if you have more than one autoclave, it's each autoclave every week.
So actually, that I don't have in the sterilization note, if you have 2 autoclaves, then when you're identifying and putting the cassette or the wrapped instruments into the sterilizer, you need to put a note saying which sterilizer you sterilize this in, because you need to know if one sterilizer at the end of the week is not actually sterilizing, you need to know which instruments were in there.
Yeah, we have 2 autoclaves, so we have logs, and we have dry erase boards of loads, so we keep track just in the event that happens.
Right.
You know?
So if it's a cassette and you wrap it, you have to put the indicator on the inside as well as the tape on the outside. Because when it comes out of the sterilizer, you need to verify that the color on the tape is changed. And then when the patient is in the chair and you unwrap the cassette, you need to verify that the inside has also changed as well.
Absolutely.
So, you know, it sounds like a lot, but you get into routine
and habits.
And habits, and it's what you need to do, and you can't make a mistake. There's no room for mistakes. You have to do this is the best practice. You really do. And sometimes we get hurried, you know, people are giving you a lot of pressure. And, you know, one thing that is really important to me is integrity. And I think about all the things that you see on the internet. Integrity is doing the right thing when no one is looking. And I was thinking about integrity, and I was thinking, okay, everyone says that, but what does that mean? Sometimes sometimes words are empty.
Right.
I think the word that's attached to integrity is courage. I think it takes courage to always have integrity. And you're going to be confronted. I've been confronted through my career about, no, we don't need to do that. Yes, you do need to do that.
It's doing what's right, even though someone's pressuring you to do it wrong.
Exactly. Or we don't have time to do that, right?
Absolutely.
I've been there, so that's why I think that it takes courage to have integrity, to really do the right thing.
So your book has how many chapters?
Has 21 chapters.
21 chapters. And what is your favorite chapter? Like, what one do you, when you have to revise and edit this book, that you're like, oh, I can't wait to, because there's so many advances, or, I just want to tweak it just a little bit more?
Oh, I don't even know if I have a favorite chapter. And the thing is that people ask me, well, how are you going to make the new edition better? Well, I have ideas, and, you go to the conventions and you find out what instruments or equipment is being used. And, so you want to incorporate that if it's a piece of equipment that is going to be used fairly frequently.
Right.
I love the technology. I think that is always great to incorporate technology into the chapters. I think, and
when I was a big CIRAC assistant, we still have one, and I was excited when that was added to the book. I was like, yes, it's in there.
Right. And radiography, there's lots of new radiography equipment that's really exciting. It's kind of interesting. The topics that I love talking about is probably not the most exciting procedure to assist at, but I love to talk about endodontics, as crazy as that is.
Where probably half the assistants out there are like, root canals, come on.
I know, right? Exactly.
But there is a lot of moving parts in an endodontic procedure. And there's a lot of things to know about an endodontic procedure that maybe we're just not familiar with, and that's why it takes so long. And there's, I say sometimes there's not a lot for us to do during it because they're filing, but there's a lot of modern advances now in endodontics. So there's a lot of things coming along that makes it, I think, more fun for us to do. So,
and the diagnosing of whether a tooth needs to have a root canal it's huge. I mean, that's really exciting to talk about, because the diagnosis sometimes could be difficult on whether the tooth really needs to have a root canal or not. So I'm not sure. I like the last chapter on, that's the last chapter that I added, was on blood pressure and
ooh, that's a good one. That's a good one, because a lot of times we don't think about doing that, or we don't know how to do it. I mean, we're trained to, but if we don't do it consistently, sometimes we forget how to. So it's good that you put that in there of how to use an automatic blood, or how to do it. Did you put it in there? How to, let's see, do it? Yep. With the custom.
Manually, automatically. Right.
Yes.
Yeah.
Non-automatically, the old school way, as I should say.
Right. Because sometimes the automatic ones are not accurate. But one thing I do have in there is you need to be sure that you use the correct size of the blood pressure. Yeah. Because if it's not the right size for the patient, then you're going to give a false reading.
Yes. Oh, you even put an EKG machine.
EKG, right.
Because a lot of people use the pulse oximeter for the sedation dentistry.
Right.
And some of the assistants might not even know how to read it, or what to look for, or what is normal with it.
And the EKG. So in California, that's one of the things that you can do as a registered dental assistant, is you can't diagnose an EKG, but you need to be able to read it to know that the patient is maybe in trouble or not normal, or that it's different from the beginning of the procedure to the middle of the procedure. So that's one of the things that that we're able to do as a registered dental assistant. And yeah, it's actually important to know. It's you know, we're not supposed to diagnose. So, but you really need to. There's a fine line. Okay, I'm not allowed to diagnose, but I need to say that this patient, something's not right with the EKG or the pulse oximeter. Yeah. So, yeah, as the chapters go on, they get a little bit more more complicated, I guess. So let's just talk about the oral surgery. There's 3 of those. So there's a general oral surgery chapter that whether you're doing whatever surgery you're doing, you're going to need these instruments. And then the next chapter is actually extraction. So there's the forceps that you would use for maxillary, mandibular, molar, premolar, and there's those. And then, and what's really nice that I didn't talk about is on the written page, there's a cameo picture.
Yes.
And that cameo picture shows you the instrument being used. So now we know the name
little
of the
little thing right here.
Right.
Yeah.
So we know the name of the instrument, its basic function, some special characteristics. We know how to sterilize it. Now we're actually seeing the instrument being used. So I think that's really important to know. It's like, okay, so I know all these. So how's it being used in the mouth?
Absolutely.
Now, some of the pages I don't have room to have a picture, and my goal is to try to get as many of these cameo pictures as possible.
Okay.
Taking the photographs is my dining room is like this photographic.
The dental photographic hall. It's like the dental photographic room. I can imagine all the pictures and pictures that you might not be able to get because sometimes it's hard just to get the right angle and maybe it's not done all the time and or
you have to do it in the patient's mouth. And so it's hard for me to bring the photographer to the dental office. That's a problem, Yeah. So a lot of times I'll get it from other textbooks if I can. Yeah. So
how often, once, every school or educator should be giving this to their students or included in their books. Right. I mean, it's really important. Even though they go through the Modern Dental Assisting book, all those instruments are not in that book. This is a separate, pocket guide, like you have said, where all the instruments that are in your Modern Dental Assisting educational book are not going to be as detailed as in this. So this is really a good added function for every dental assistant educator out there, or even if you're not in a dental assisting program and you've just started out and you can't get your hands on a bigger book, this is your next go-to to definitely have this. Put it in. I always think of it like, even though it's a little heavy, those doctors that are residents pull out and they're flipping through all this stuff. This is what we need to do.
Exactly. So what you just said is one of the reasons why I actually wanted to do this book was because in Modern Dental Assisting, the instruments are in there. Actually, most of the photographs in there, if you actually look, they're from my textbook, and they give me credit. Yeah. But so they're dispersed throughout the book. But that's why I did this, because this is a comprehensive book on just instruments.
Right.
And
sometimes it's so well laid out that you won't have time to pull out your big book and look through the root canal section or the endodontic section when you can just go here and go and keep flipping. So it's really a great tool. And now's the time, since maybe some of us are, relaxed and have some downtime on our hands, not that we want to, that we take and go through this book and start refamiliarizing ourselves with the instruments in our practice to better see how we can help our doctors.
Right. And one of the things is that the reason that I don't have any words on the picture is because I want you to use this as an index card, like a flip chart. So you can look at this instrument and test yourself, and then you know what the answer is on the other side. So you do it as like an index card, So that's one of the reasons why I did it in this way, where there's no words with the picture at all, because it's all, if there's arrows on this, 1, 2, 3, 4, it's down in the text part.
Awesome.
And you can match that.
Awesome. So, Linda, where can I know the 7th edition is coming out and you can get it on Amazon, but there are the 6th and the 5th editions, as I looked last night, on Amazon still.
Yeah.
There's still some
Yes.
copies available. So you can get the 6th edition. And you said the 7th edition will be out when?
I think, well, they told me it was going to be out in March, but it's still on pre-order. So
Okay.
I think April. Yeah, soon. It should be out soon. Yeah. And the thing that's different in this is I have more identification of the parts of the instrument and equipment. I have more like 80 plus new photographs, just
Awesome.
maybe taking a better picture of some of the instruments that were already in here. And the sterilization note, it means the same and the end result is the same, but it's a little clearer. I spend a lot of time making that very precise and get the guidelines from the Center for Disease Control, the MMWR. Anything you ever want to know about what you do in the dental office as far as infection control, you can just type in MMWR and go to the dental and everything. I mean, it'll tell you what your nails are supposed to look like, what your hair is supposed to be like, everything. And as crazy as this seems, when I start reading that, it's almost addicting to me. I just want to keep reading it, even though I know it's in there.
Well, you know, it's funny because I think every time I go back and read it and go over the infection control processes, I find something else I didn't catch the first time, you know, because I'm trying to absorb it all, but you can't absorb it all when you read. And I just have to keep reading it and going back to one section about wearing gowns or wearing the mask and how to properly don and all that stuff. And I'm like, I missed that the first time and stuff like that. So it's just becoming more aware. And, you know, with your guides and all your books and your resources, now I think is the time for us to kind of maybe even take an hour a day and focus on our careers, even if we're not in them right now in a practice. Take an hour a day, whether you are sitting at home, reading through your modern dental assisting or your dental instrument pocket guide, or on watching a CE webinar or something, just to keep yourself familiar and fresh and maybe even better than the day before, because I really don't think now's the time for us to, I'm going to be off for the next 6 weeks to kind of just do nothing with our careers, you know?
Right.
Keep it relevant.
It's really important to do that. And, you know, you go through, just choose a chapter. Yeah. And go through that chapter. If you look at the whole book and go, oh my gosh, I'm never going to be able to know all these instruments. Yes, you will. Yes, you will. But take it a chapter at a time. And don't be so hard on yourself. Just some of these instruments are harder to learn than other instruments. And one day, a light bulb is going to go off. And all this studying that you've done, it's going, oh yeah, I know what this is. And that's what happened. So trust me, that will happen. But you have to work at it and just keep doing it over and over again. And that will happen for sure. Yep.
I had to laugh because a couple weeks ago, I've been in dental assisting 28 years. And the assistant said, can you hand me a Minnesota? And I'm like, what? I'm like, like what? I'm like, what is, she's like, a Minnesota. And I'm like, okay. And, you know, for a minute, I had forgotten that a cheek retractor that I call a cheek retractor is called that, you know? And I'm like, I'm like, what does it look like? You know, like, and she's like, the little thing. And I'm like, the cheek, and then she said cheek retractor. And then I was like, oh, because you forget the original name, you know?
Right.
And she's like, you didn't know what it was? I'm like, had you said cheek retractor, I would have known what it was.
Actually, if you go to the cheek retractor in the oral surgery chapter, you'll see that I call it cheek retractor. I can't say that. Cheek retractor. So down in the special characteristics, I mentioned that it's also called a Minnesota.
Right. Okay.
So I try to do that. So that this is the basic generic name, but then it could also be called Minnesota.
Yeah.
But I try to do that with instruments that are like that.
Yep. It was just so funny. And she's like, didn't you ever use one? And I'm like, oh no, I just had, a brain cramp. Yeah.
Yeah, exactly. Yeah.
Well, Linda, where can we find you or resources? Do you have a company or a website that they can find you on if they wanted more information or all your awesomest knowledge that you give?
Well, I do. I just secured a email address, and I haven't got it quite on yet. But
Okay.
but right now my and it's in that textbook that it's L.R. Boyd
Okay.
47 at yahoo.com.
Great.
So you can email me. I'm working on the website.
Oh, good.
Yeah, I'm working on that. So, but just you can email me at lrboyd, LRBOYD 47 at yahoo.com. Yeah.
Great.
Be sure that you put up in the title, I don't know,
Dental
pocket
assistant.
guide or something.
Yeah,
Dental
pocket
assistant.
guide.
Right. Yeah.
Yes.
Yeah.
Well, I appreciate you being on, and I appreciate all
Thank
your
you.
knowledge of giving others. And to any dental assistant out there, this is definitely a tool you want to have in your toolbox all the time, whether you have one at work and at home. Sometimes right now we're going to need them
Yes,
at home,
exactly.
right? So,
Right.
but I appreciate you being on, Linda, and I look forward to seeing you soon.
Thank you. And I welcome any questions that you might have. So
Great.
please feel free. Yes. Thank you. And thank you very much for having me.
Oh, you're
Good-
welcome. Have a great
good luck.
day, guys.
Thank you. Have a great day. Thank you.